Okay, it's recording.
Good evening, everyone. I just wanted to get us started this evening on our CTE marketplace. And I wanted to remind everybody that the Wyoming Department of Education does not necessarily endorse or promote the products and services of this vendor, but we are here to help connect you. So with that, I'll turn it over to our presenter.
Okay, we are happy to have an opportunity to meet with teachers in Wyoming that we believe have responsibility for delivering health science education. And so with that, I'm going to pull up my PowerPoint and I'm going to ask Eileen if she is seeing it. Are you
I
seeing?
absolutely do. Yep, I absolutely do.
Okay, great. Well, we understand that life is busy, and so we're happy to record this for you and just tell you a little bit about the National Consortium for Health Science Education. I'll introduce myself. I'm Nancy Allen, and I serve as the executive director for this collaborative. And if you've not heard of us, by the end of this brief presentation this evening, you will know a little bit more about what we're doing. And so we know that as health science teachers, there's some things you can control and there's some things that you can't. And we're going to talk about some things that you can control that help you deliver a high quality health science education program. So the National Consortium, I'm going to move this up just a little bit. So this, oh, sorry, my friends. Okay. The National Consortium for Health Science Education has been around for nearly 30 years, and we are a collaborative of health science state leaders and also publishers and educational resource providers and professional organizations, all who have an interest in health science education, and specifically lots of focus at the high school level. So we're interested in what you're doing in your classroom, if you're using the National Health Science Standards, what you're teaching, how you're preparing the next generation of health professionals. So we, through our work as a collaborative, we have an opportunity to meet and understand what goes on in other states. And so we were absolutely thrilled when Wyoming reached out to us to say, what might you have to offer to health science education programs in our state? So we have a vision, and we have been around, like I said, and we have developed these national health science standards that provide some consistency across the nation. So what a student learns in Texas, if they complete a health science education program, may be similar to what a student learns in Michigan. So that when they go off and they leave us and they graduate and they move on to post-secondary education, and hopefully they select health science as a major. But even if they don't, we know that they have some life skills that will prepare them for taking care of loved ones or for taking care of children. But basically, we want them to be prepared if they do go on to major in a health science field, that they have a competitive edge over their maybe their peers who've not been involved in a health science education program at the middle and the high school level. So we want to talk about some ways that we can support you and the good work that you do there in Wyoming and what goes on in your program areas. Okay, hold on. So just a little bit about, I don't know if you have courses. Eileen, do they have courses with standards that they follow, or is it a local control type of situation?
We do have local control here in the state, but we do also have state standards. So,
Okay. And within the health science program, are you familiar with what those courses are called? I think we talked a little bit about maybe some EMS and maybe some introduction to health professions.
yep, there's also like basic emergency. We do have one or two health science instructors that are, I believe, Red Cross certified, instructor certified. So they're kind of doing that type curriculum that then leads to that credential. So
Okay. And it sounds like you have some maybe we did mention maybe a sports medicine, a little bit of
Yes.
that.
Yeah, he actually is also one of the Red Cross instructors, I believe. But yeah, he is there. There are, I think, two in the state maybe that are sports trainers as well.
Okay, good. Well, just a little bit about the National Health Science Standards. If you're not familiar with these, they are posted on our website at healthscienceconsortium.org. And you can see the 11 broad foundation standards that have been validated by health professionals across the nation about what students need to know and be able to do when they complete a health science program. But underneath each of those standards, things like academic foundation, communication, safety, legal, ethical, health maintenance practices, career awareness. Underneath all the standards, we have objectives so that it gives teachers and students a clear framework about essential knowledges and skills and what students should expect to learn and what teachers should expect to teach. So clear direction, and educators understand what it is they're supposed to teach. So we invite you to visit our website, look at the National Health Science Standards if you're not familiar with them, and just, you may be surprised. Yeah, this is really what I teach as well. And sometimes teachers will say, I don't know if I really cover that. I'm not sure if I include all the national standards in my, in my daily teaching. And so on our website too, we created a template. So you could go in, you could say, yes, I do teach anatomy and physiology in this course. I do teach medical terminology in this course. So it gives you a way to crosswalk and maybe to confirm that you are including the National Health Science Standards, so that if your students launch out and go to college or university in South Carolina, then they have they've mastered those same skills and knowledges that students they may be sitting beside in class. We did have some states to say, we really don't know how to order these standards because they aren't courses, it's standards. And so some states have said to us, when do you teach that? How do you teach it? At what grade level do you teach that? And so over the last year, we took our standards and we grouped them in some sample courses. And so foundations of health professionals, that may be similar to some of your intro to health careers coursework that you have there in Wyoming. So we took the standards and we have them separated out by courses. And this is just, some states really like this. They wanted to know how to deliver the standards and what order to do it. And so we listened, and that's what we've created. And so on our website, if you're interested to see what's included in each of these sample courses, you can visit there, and it outlines what standards are covered in each of these 4-course sequence. It can be year-long, semester, whatever works for you. Now I'm expecting someone to join me here, but I'm not seeing her yet as having joined me. She was going to talk about some of our classroom resources. So we may, we're just going to plow through until I get a message that Rhonda's in the waiting room. But we have a couple of resources that we promote, and one of them are our curriculum. Let me make sure this isn't Rhonda on the, well, here she is. Hold, please. This is, hey, I'm in the Zoom waiting room, she said. Okay, but I don't think she's showing up there. So just hold on a minute. Let me see. Oh, there she is. So Rhonda is the developer, one of the teachers who helped develop this resource for teachers. So perfect timing for Rhonda Evatt to join us. And let's see if she's, Rhonda, you with us?
I am trying I'm trying desperately to be with you. Okay.
Okay, thank you.
I had to log out and then log back in, I guess, because it had me waiting in the waiting room for quite a while. But
yeah, and I didn't get a message that you were here. So what we have going on here is a recording because we didn't have any teachers actually join, but we're going to make sure that they have an opportunity to visit this at their leisure. So did you want, we do have one of their staff members, Elaine Brown, with us. She introduced us, and they were going to make sure that we have contact information for the health science teachers in Wyoming. So do you want to share your screen as you talk about the curriculum enhancements? Okay.
I do. And hey, Elaine, it's nice to have you.
Thank you. I'm glad to be here. I love this.
Oh, excellent. So awesome. Well, I will share my screen and
okay, and I may have to, I'm gonna do a new share.
So Elaine, while she's getting ready, since it's kind of, I guess it's kind of informal, sort of.
It is, definitely.
That's how we roll.
Yeah, I like it. You see my informal, it poured rain all day today here, right?
I already told her that.
Holy cow. I looked at my head and I was like, this is great.
Okay. Now see if you can, I did the stop share and then multiple participants. Okay, you should be able to share now.
Okay, it says host disabled participant screen sharing.
Okay, multiple participants can share simultaneously. Okay, I'll just hit that.
There I am. Okay. All right, let me let's do that. And okay. So you should be seeing my Zoom system dialog.
What we see.
Okay,
that's what we see.
Great. So Elaine, I'm just gonna what I'm gonna do is just go through and kind of show you an overview of the enhancements and how it's laid out. That's the biggest thing is how it's laid out and what you need to do to kind of navigate it, I guess. And
And Rhonda, I haven't really done an introduction about what the enhancements are.
Oh, okay. Well, and that's kind of what I was going to say is if there's something along the way that a question you have or anything else I can kind of bring to the table technology-wise, that's one of the things I do a lot of is just kind of help manage the tech side of things. And I'm going to turn my phone off. Okay. All right. So so have you had the enhancements, or do you know what they were prior to this, the older enhancements?
No, they do not. Their programs are have had a focus on CNA. They've also had a little bit of focus on EMS, smaller focus on sports medicine, and then kind of an intro to health professions. So their program, they're few and far between. They probably have maybe 10 health science teachers.
Yep, throughout the state.
Throughout the whole state. So we just, our goal is to grow them, and they do have some health science programs hoping to hatch, I think, next year. So we tell them we're not so much in the selling business as we are the networking and support business. So you just touch on a little bit about how this resource could be quite valuable for a health science teacher.
Okay? That sounds great. Okay, so a little bit about myself, and I've been a respiratory therapist for about a little over 30 years. And I left the clinical setting to teach high school. Long story, but anyway, I ended up starting to teach in 2013 at one of the high schools, and had just a phenomenal co-teacher that, just, I don't know how I would have done it without her, but I ended up teaching 4 preps. So I taught Health Science 1, Health Science 2, our Health Science 3, is human bodies, like a anatomy and physiology, more like a pathophys class. And then I started out doing the classroom part of the CNA program, and we had a registered nurse that would come in and do skills checkoffs and take them to clinicals, and that we were only able to maintain that for a couple of years. So then I brought in the triple threat is what we called it, was certified EKG tech, certified phlebotomy tech, and I prepared them because it was a self-study program for the certified patient care tech. So they would register on their own. So Katrina and I have been, we've known each other for the entire time I've been teaching, but we lived across the state from each other. But we're both kind of weird tech geeks. And, you know, I could not work, I could work a computer when I started teaching, but I had no idea about all the educational platforms. And I just wanted to learn all I could learn. And that just kind of put her and I in a similar category. And we, through the years, just talked about really wanting to do something. And then all of a sudden in November, they had a call for proposals for the enhancements. And what those are, it's an enormous resource built around the standards that already exist. As we started, you know, preparing to submit for this, we had in our brain what we wanted it to look like. And what we wanted for teachers. And it's easy to do lessons. A lot of it, everything we had, or I'll say, you know, most of everything we have can be done either digitally or in print, or you can also alter some of the lessons. They're all editable. So you can go in and edit them to actually just fit what you're doing and take something out or add more to it or whatever you want to do.
And they're completely face-to-face. All their schools are complete face-to-face.
Yeah, oh, yes, we are. Yeah, I'm in my second week teaching face-to-face at a career center. So I have the students in semester classes, and I have 3 hours in the morning. I have 30 minutes for lunch, half of which is spent having to clean my room with all the spray. And then I have 3 hours in the afternoon, and they lock the school at 5 o'clock. So it's been a week, that is for sure. I'm in a very small classroom, and thank goodness I had these resources that me and Katrina did. So we are definitely day-to-day teachers. We don't work for huge publishing companies. These are lessons we've collected of our very own over the years. So I'll show you what we're going to look at.
So Rhonda, can I just ask real quick?
Please.
So are you like an open resource type situation where your stuff's all online and people can just go on and take a look at it? And
not at this point. What we do is we share some stuff through our Facebook groups, the NCHSE Facebook group, and the health science educators, and then our also in our South Carolina health science educators. And when we first went into the COVID situation, it's like I felt like I was in the emergency room trauma all over again. Yeah, because I had what everybody else needed, and Katrina had what everybody else needed, and some of our close allies had that too. And we started pushing stuff out onto Facebook to help these teachers that were just floundering. And we did a lot of webinars through NCHSE, and we created a shared Google Drive that had a lot of these resources. So we were only a month or two into creating this when this happened, and we just looked at each other and said, we have to do this digitally. We've got to make everything digital. So it kind of changed our trajectory. What we have here is a really good framework for lessons and resources. What we found was the need at the time is if you are a NCHSE member or if you're a NCHSE member, you're a health science educator member for national. And we pushed all of the resources we had into a shared Google Drive. And there's a bunch of them. I'll actually open it up and show you what there is here in a second.
That'd be great. Thank you.
And yeah, for a membership, for the $45 membership, we have endless resources. Now, why did we do it like that? Well, we didn't until just a few weeks ago, because it was out there so much that we were inundated, and I'm talking 30, 40, 50 messages and emails between myself and Katrina every single day of our life, with teachers needing help and needing us to tutor them through it. And I mean, it was taking just over half a day just to, and we try, you know, I would just sign on to Zoom meetings one-on-one with people across the country and screen share and walk them through stuff. It became just too much for us to manage just as normal individual daily teachers. And then what we found were the files that we had shared nationally were getting altered. And they were, people, instead of making a copy of them, people were actually going and editing the files. And so as school started, we said, you know, we put it out there and said, hey, September 30th, I think was the date Katrina put, I don't remember. But because Katrina manages it. We said, you know, you have until this date to get what you need off of it. But after this date, all of these resources are going to be in a, you know, in a locked file for health science educator members. So, and it's just so that it could be managed better. And even just the memberships themselves were more than Katrina could handle on her own. So there's actually someone helping her with membership now, because it's just blown up like crazy. So it's a great network, and there's a lot out there to be shared. So let me show you what we have here, and then I'll hop over to the shared drive. How does that sound? All right, so the setup of this is going to be you have your A, B, C, D, E, F. Okay, so there's those. And these are the extras. So these are everything we threw in there that are very general.
Rhonda, we aren't seeing, all we're seeing is you. Are you trying to show us your screen?
Yeah, it should be.
We're
Okay, hang on.
seeing your face.
It must have.
Not that we don't like seeing your face, Rhonda, but
Oh
that is.
no, honey, I don't like seeing my face right now. Okay, let's try again. That's weird. All right, all right, you see it now? Okay. Excuse me. All right, so we have the start to here file. Okay, that's there for a purpose, and nobody looks at it. so we tried to put here is everything you need to know and how to navigate it. Okay, and so if this is something that your teachers find helpful and y'all do end up getting it, then literally going through the very first folder and looking through it is huge. Because if they don't, then they're gonna, you know, everybody will email Nancy and say this isn't working. But it's really just a matter of following how to download the zipped files, and it's just basic technology stuff that not everybody knows. We put our web resources in here. I'm just going to open this one up for anatomy. And these are literally the resources I have used for years that I just hoarded for the most part, and put them all in here. So this is all, by the way, I have a brand new laptop the school gave us, and I'm still learning to navigate some of it. So, all right, so these are all anatomy and physiology things. Everything you see here, and most of them, as far as I know, are free. And I've gone in and checked links and all that stuff. There's free digital resources here. I'm trying to go back. Okay, you still with me on my screen?
Yes.
Okay. These are for all health science teachers. These are the resources that I've used that have lessons already created in them. These are proven, and a lot of them, they can be used in distance learning for sure, or a lot of them in the classroom you can print stuff with. They have lesson plans, they have assessments, they have activities, and all of these things already have that kind of stuff in there. And it just goes on and on to show some things. And then there's some other tech resources that come in with these others that are teacher sites, student sites, and that's just to, you know, all kinds of creativity stuff. there's a table of contents there and all that kind of stuff. General classroom help. These are going to be things that, things like our doodle notes, templates. Kids do a lot better when they're doing, you know, with the colors and pictures, and it's not, you see it's waiting, it's not happening. All right, well, Google doesn't want to cooperate right now, so just a minute. There it was. I'm sorry. Anyway, I'm just going to move on. These are just templates they can use to draw in their notes and stuff. For our digital classrooms, we have things like, here's a digital notebook I created. And it's not loading. I'll talk through it, it'll load. This is like an editable template. There it is. And you can go in, and I have it in there in 3 different ways. One, you can go in and read the instructions and set up the tabs yourself. And the other one, they're all pre-populated with tab 1, tab 2, tab 3. So these are just different like notebook pages. They can go in and do their medical terms. They can, and I just put a couple of other extras in here if they wanted to use them. And so that's one of the things we have for digital classrooms. So if you scroll on down, there's a ton of augmented reality and virtual reality. And that sounds real scary, but you literally print a piece of paper with a picture on it and open the app and you hold it up in front of the camera, the little piece of paper in front of the camera, and these body images and organs jump off the paper like a hologram. It's ridiculous. It is so cool. And so we have a lot of those that are already done and pre-print and ready to print and all that. Your academic foundations, and again, these are going around the NCHSE standards for health science. We have body organization. These are all the different body systems. All of these files have their very own Start Here file. So you would want to go in here and look at the table of contents first and see what's here. And then you would go to, that was just a list of everything we had. Then you have your outlines, and your outlines go, we broke down each of the standards. I don't know why that thing wants to stay open. We broke down each of the standards, and what we did was took the activities that we added in here and put those activities next to the actual part of the standard that they would match with. So this is an activity called Cell versus Cell, and it has to do with teaching the cell part, the parts of the cell, to the students by using a cell phone, like a huge image of a cell phone, and the apps that go with it, and the different apps and how they relate to the internal organs of the cell. So we have all these, and I'll kind of go back and show you some of those and what they look like. We have those all the way through here. And then if you see the blue links, these are the hyperlinks. So these are the ones that will actually take you to a site. So there's some confusion as to these being underlined, that the link isn't working, but it is. There's no link. These are the ones that are actually in the activities. So blue is hyperlink, black is not. I'm going to go back and show you what some of
Hey, Rhonda, we're looking at about five more minutes.
Really?
Yeah.
Okay.
It's
where did the time go? Yeah. Okay. I will show you this, and this is the Cell versus Cell.
And can I just ask a quick question again, Ron?
Yes. Mm-hmm.
So these are all great activities and like are, you know, according to different standards, but do you have a bunch of industry recognized credentials that you use or you recommend for?
I'm glad you asked that question, because that's been a big one. So our job, the job we contracted to do, was to create all of these resources going around the standards, because most programs end goal is to have their students pass the national exam. So these were all created to go around supporting those. That's why we're so big on the standards, because that's what most of the programs are shooting for. And here's the little cell versus cell thing. And we drag and drop, and there's all that. So I've been asked a lot, well, why didn't you do EMS stuff? And why didn't you do, the only thing you did was CNA? And the reason is because for this purpose, those other credentials are not aligned with these standards. I mean, the foundations are your basic health science classes, but like your EMS, there's a national EMS foundation, you know, or their association, and that's where all of their credentials are outlined in their standards, and this is what you must know. And for phlebotomy, these are the things you must know for phlebotomy. And so all these credentialing resources have their very own set of guidelines and standards. And so these are for foundational things that what we did put in here were resources that would help all of those. For this purpose, we didn't include those because, let's just say, sports medicine pathway, that's not a part of these standards per se. The foundation it is, and health science is, but the sports medicine, and I can't remember what it is now that I thought of that,
NATA.
Yeah, NATA, they're the ones that are the support system for sports medicine. So we've recognized that being digital, and because I've gotten, you know, we've all been thrown in the middle of this going, you know what, there's got to be a way to tie this together for these resources. And there's not a lot out there for sports med on the health science side, except, again, your foundations. But we've recognized it, and I feel like there's some awareness to it now. Now, I will tell you that we use a lot of Health Center 21 stuff, and they have, as of the spring, they have aligned, please don't judge all my folders, they have aligned.
We're judgment free, don't worry.
Oh, Lord God, don't wait till you see it. It's bad. And so I'm gonna, sorry, I lost my train of thought. Vision drafts, told you.
So basically what you're saying is, like, this is a great foundation for, it doesn't matter what the credential is.
Right.
Because the information that you have, that you're able to provide for this $45 a month or whatever it is all basic information that can be used across the board.
And it's $45 for a year. It's like an annual membership.
Okay.
And
Okay, about 2 minutes, Rhonda.
okay, I'm hurrying. I don't know where it is in this new computer. Let me go to shared drives. I bet it's there. Right, I don't see it. Let me just search.
And Nancy, we don't need to be at a hard stop right there, so.
Okay, thank you. Yeah, it may take me a minute. I had to upload all my files to here, and off my old computer, and oh wait, no, that's Nishi. I'm sorry. Nancy, you can hop in and you know, share anything you want to share real quickly, and
Okay.
I'm gonna find this.
All right.
Okay?
Well,
So give me just a second.
and I was going to go back to my screen, but this resource is available. So we have state members. So we have almost 30 states that are members of the National Consortium for Health Science Education, and we provide state discounts. So if a teacher or a school wanted to purchase the health science curriculum enhancements that Rhonda has given you an overview for, if their state is a member, it's $350 for all the content. They get to download it. It's editable. They can, you know, upload it to their learning management system, to their Google Drive. If their state is not a member, we don't want to punish those people whose states are not a member. So if a teacher joins the Health Science Educators Association, that's a $45 annual fee. They can also get the same discount. So instead of being $500 as published on our website, If they're a member of the teacher organization, it's $350. So there's two ways that we do discounts: through a blanket state membership, or through an individual teacher who is a member of the consortium of the Health Science Educators Association, so they can
So,
get this resource for $350. Okay.
okay, since we're a local control state and the state doesn't pay for any of this stuff, they would probably have to go that route, is what you're saying, right?
Yeah, and they're happy to reach out to me. I'll share my email when we at the very end. Did you have anything else you needed to show there, Rhonda, before I go to my screen?
Go ahead. I was just going to go ahead and let you have the screen, and then that way y'all don't have to watch me driving around here. And then when I find it, I'll let you know.
Okay, good. All right, so Rhonda's told you about the curriculum enhancements, and those were just released in August. Are you seeing my screen now?
Yes, ma'am. I think so. Are you
Okay.
the curriculum enhancement screen?
Yeah.
Okay.
Right. Okay, so Rhonda shared about that, and I just want to say that we are happy to add any teachers from Wyoming to our database. We do a monthly newsletter that has tricks and trades that you can use in the classroom, just little classroom tips. Sometimes it's little quizzes, sometimes it's activities, but we also post these on our website. But if you're a part of our database, we're happy to include you in newsletters. The exciting thing about the consortium is that we have a great relationship with publishers and educational resource providers. So what we create is not to take the place of the wonderful textbooks or online curriculum that you may use in your classrooms or your workbooks, whatever you have from our publisher friends. What we're doing is just supplementing the good work that they do. And what we appreciate about our partners that do create these resources for health science classrooms, and that they are including the National Health Science Standards. So they recognize the value of the standards, and you will see them mentioned in many of the textbooks that you hopefully use in your classroom. Elaine had a question about certificates and what students may be able to achieve at the high school level. So we do have a certificate program too. So at the end of a health science program, we have the National Health Science Certificate, and that's an online computerized test that your students can take when you believe that they've mastered all the National Health Science Standards. And for member states, it's $12. And for non-member states, it's $15. And while it's not a right to work, it does validate what your students have learned. It helps you as a teacher. You would get back to say, oh, my students did great on this standard on teamwork, but they did terrible on this standard on academic foundation, which was the anatomy and physiology. So we think all that data is really great for a classroom teacher to say, I need to spend a little bit more time here, provide some accountability for you. So we have lots of certificates. One is the end of program that I just mentioned, the National Health Science Certificate. But underneath there, we have a sports medicine certificate, a medical assisting certificate. And so we invite you to visit our website. All those are listed there on our website. So end of course, end of program, and our partner for these exams is UScience by Precision Exams, and they're all very affordable, anywhere from $8 to $15, but it gives your students something to add to their resume, and the certificates have all the standards on the back that they could present to an employee to say, this is what I learned in high school, this is what I know, and can bring to your organization. We talked a little bit in the beginning about just networking and partnerships, and just wanted to mention one more time our teacher organization. This was launched about 2 years ago, and so we really heard from our customers to say, you know, we really need a group where we can share, where we don't have to create. You know, if somebody has a great website for this, or a great way that they've taught this skill, we'd like to be able to share and communicate with teachers across the nation. So if you go to our website under the Educators tab, there's information about how to join the Health Science Educators Association. We made that very affordable. It's only $45 a year. And more than just a network, there also is an exclusive access to online classroom resources. So in addition to all that, what Rhonda so eloquently shared that they created over a 6-month period, there are even more resources. So if you join the teacher organization, you get special access to more classroom resources that are mainly different from what Rhonda was sharing, that are for purchase.
I do have that pulled up now. If you want me to share screen,
Okay.
and show her the HSEA Drive.
All right. Stop share. Okay. You should be able to share.
Can y'all see my screen?
We can.
Okay, good. Excuse me. All right, so this, everything that you see here, and there's more to it than I could ever go through. This came from a whole plethora of teachers when we launched into distance learning. This was all over the country, like we were all helping each other. So everything you see here, I mean, I can show you the ones that I know are mine. Oh, that's not it. This diagnosis of the day. No, I did not create this at all. But I did come across it somehow, and I couldn't even tell you how. Like my first year teaching, and I use it as a bell ring. So there's like 40 of them. And so I just threw them out there, and these are great little case studies to make them think and look for stuff. There's, I mean, just so much. Phlebotomy, there's some phlebotomy. I know there were a couple of people that were going to add in some sports medicine and EMS stuff. Here's a bunch on infection control and stuff for them to use for any kind of epidemiology or basic health control. Here's the anatomy. Some of these are missing. I think this is the old one, because the other one, this must be the old one because it has this little, my trash is changing. But the folders are just literally screens full of stuff. And these are how to do doodle notes. There's just so much content to it that I would never even be able to get in there. This came from me because there were a lot of people wanting EKG resources. And at the time, I just was able to pull these websites that I used when I was teaching EKG tech. But there is something for everybody for sure in here. And so I guess, you know, when I come on to a webinar with Nancy, I'm basically coming on as an advocate for teachers and to say, there's stuff out there to help you. I'm not selling anything at all. This whole organization has just been a huge blessing to me, and I'm a big advocate of it. But it's just to show you what's out there for your teachers, to just enhance their learning, because textbooks just don't always do it all. And I will say, for that $45 a year, just to be a member and be in that, be in the drive that has tons and tons of stuff. It is absolutely worth it for sure. And, you know, we're always taking anything that anybody wants to share with everybody. We just send it through the pipeline and say, hey, put this on the drive. And we just send it to the email and it gets put on the drive. So it's not just us, it's teachers from all over the country that are contributing and still contributing to this day. We add stuff to it every week.
Okay, thanks, Rhonda. I'm going to share back real quick. This, so y'all seeing my screen now?
Yes, ma'am.
Okay. All right. So we were just talking about networking, and I know your teachers there in Wyoming know how important it is to be friends with guidance and look to your community for ways that they can help support your program so that they can be maybe members of your advisory council. If I know through Perkins, you're likely required to have an advisory council to help you shape your program. And then hopefully some of those partners then begin to serve as work-based learning sites for you. And we know that looks a little different with COVID, but hopefully one day we'll be back to a little bit more normal there. Just lastly, as we know our time is coming to a close here, we do offer Wednesday webinars, and you don't have to be a member of anything to attend those. We have those posted on our website under events, and we have one coming up the end of the month on industry certifications. That's on September 30th, and if we get your email addresses, we'll be happy to send you an invite for that. But Wednesday webinars are offered 2 to 4 times throughout the month, sometimes delivered by teachers, sometimes delivered by health professionals, and an array of partners who we believe have great information to share with you for your classroom. We are excited. Oh, I'm going to step back here just a minute. Our National Health Science Conference is an annual event. This year, of course, it'll be virtual, but it'll also be affordable. And so it will be the last week in October 27th through October 31st. It'll only be 2 hours a day of live content, but all that will be recorded as well. It's only $175 to attend. So we'll have live content in the evenings. For you, it would be more like 3 to 5. But if you're not able to attend live, it'll be recorded. So we'll have keynote speakers, we'll have networking opportunities, but we'll also have 50 breakout sessions, and those will be available for 30 days. So we know that people suffer from screen fatigue, and so we want to make this available to you for 30 days. And so you can pick and choose those workshops that seem very relevant for the work that you do. And so we encourage you to think about professional development, even though it looks a little different. It will be virtual, only $175 through October 1st. Then after October 1st, it'll go to $200. We would love to have some teachers from Wyoming to join us. We talked at the beginning about controlling things that you can control, and we certainly want to be your friend. We want to be someone you can lean on. And so bookmark our website there, healthscienceconsortium.org. There you find out about the Wednesday webinars. All our webinars are also recorded and posted there, as well as our newsletters, as well as information about the National Health Science Conference. We want to be there for you, someone you can lean on to help support the good work that you do in the health science programs there in Wyoming. There is my email address, Nancy. It's the longest email address in America, but it's nancy@healthscienceconsortium.org. And so I can answer any questions for you that you might have after watching our webinar, or also happy to connect you with teachers who may, have some great ideas to share with you. So Rhonda, anything else you want to add?
Nothing I can really think of. I, coming into it, I just want to, there's so much content out there and there's just so many things to say about it all. But, I will say that Katrina and I are going to be doing pulling out some of the lessons and showing them to everybody. And I think that's just what it's been about, is we found an opportunity for us to help other people through the social media and through NCHSE, and we accept help as well. So it's kind of a we're all in this together thing, and we're always available to run things by or ask questions about. And I go out there and ask questions too. So it's one big health science family.
Yes, it is. I want to I'm going to show one little 1-minute clip here because Elaine had the question about credentials. We know that at the high school level, there's not much, not much we can give them in the way of right to work because so much of healthcare and the careers in the health professions require post-secondary education. So we think about certified nurse aide, we think about perhaps EMT, phlebotomy, EKG. But I did look up one of our partners, Past Assured, they offer an online pharmacy technician training program. So I'm going to play that because I noticed, I looked up that in Wyoming, to be a pharmacy technician, you need the PTCB, which is the Pharmacy Technician Certification Board, and they are a member of our organization as well. So tell me, are you seeing that?
Yes, ma'am.
Okay, so we're going to play this and then we're going to say goodbye, but this may be something that your teachers would be interested, or if a school district wanted to purchase this for a student, it's $299, but it provides them the content to be successful in national certification that's required in your state.
Assured's Pharmacology for Medical Careers complete online training program is designed for the virtual and physical classrooms of today. Our training course may be used on any device of your choice. Whatever your needs are, Pharmacology for Medical Careers may be instituted as a complete class, a class within a class, distance learning, and independent learning. This course may be offered to juniors or seniors since the PTCB does not require persons to be a high school graduate to sit for the national exam. Pass Assured will prepare your students for either of the 2 national certification exams, the PTCB or NHA's EXCPT. Please contact us at your convenience if you have any questions or simply want to place an order. Thank you and take care.
Okay, so I just thought that might be of interest to some of your teachers if they're, I know that work-based learning opportunities and maybe CNA is hard to get those clinical experiences. So there's no clinical experience required to sit for the PTCB. So just wanted to share that. And then we wanted to hand you the microphone, Elaine, in case there was any questions that you might have based on what Rhonda and I've shared today.
Well, I think I interrupted enough to give you all my questions, but it's super exciting to see all this information that's out and about that's available to our teachers, because I know I keep asking about industry recognized credentials, but that's how we're assessing kids now for Perkins. So if that's how we're assessing students, we need to make sure curriculum and information that we're providing is what is going to make them successful to pass these. So to know that your information is basically the foundation of what all credentialing will need to be. I mean, it's not every piece of it, but it's a good foundation, right? That's I think that's just in itself amazing. So thank you for that.
I want to just share something quickly, 2 things. One thing is that the OSHA, just for y'all, because you are trying to get off the ground and get that Perkins assistance, is the OSHA training through, gosh, I just had it in my brain. I'm sorry. There's an OSHA certification. What is that? What is Career Safe? Career Safe.
Career Safe.
Career Safe OSHA certifications, and it's like $5 per certificate, and it goes.
We've been telling people all about it. Yeah.
Okay, good. Well, that was one, and the other thing, and I'm sharing it with both of you because it was great today. We're going into careers. I'm teaching out of the red DHO book, and we're going into the first page of careers. And when it gets to the 3rd paragraph, there's an entire section on the National Consortium for Health Science, Technology, Education, which is what it used to be, and how they set the standards for every single career pathway that there is in healthcare. And I just sat there and I was like, I feel pretty special. So it was just so neat for me to look down into the textbook that I've been using for 8 years and see it there, and it does set a standard.
Yeah, and it's, you know, it's validating, right? I mean, it's just so amazing to know that we're all trying to get on the same page. So I just wanted to thank you guys. And like I said at the beginning, we are not, you know, endorsing any vendors or doing any of that stuff, but this is just good information.
Yeah, it is. It is. And your teachers would learn, and you, I mean, to see how to grow and to have these mentors in the country that have already taken these programs from the ground up and built them into really great, solid programs. And it's not just for the teachers, it's for the students. I mean, yeah, the Perkins money is, of course, how we survive, but providing these opportunities for the kids is just phenomenal. And the national conference is where they're going to get so much information. We're so sad it's going to end up being virtual, but for them to just kind of hop in and out of the things that interest them, there's more than they can ever even imagine there.
Yeah, I think that is great. And it's something that I think it might even help me. I was thinking about that. I was going to talk to Michelle. It might even help teachers build programs of study that are meaningful.
Yeah.
If I know a little bit more to be able to help get health science off the ground in Wyoming. So.
Yeah, you can't do it by yourself. And when you meet this network of other people who did start and did build them and grow them, and they're very successful now, that's what I personally, that's what I love. We've talked to several teachers like in Tennessee that are all wanting to implement new programs. And that's what I did. And I did really well at it. And my students were very successful. So that's the first year or two was horrible. I would have given anything for somebody to call.
Sure.
But that's what, we're peers and we're there for each other. And if y'all have some contacts of people that have had success with it, that's what you need.
Thanks again, Elaine, for inviting us. And I'll send you this recording so you can share it with your teachers. And we look forward to being a support for you and someone that your teachers can lean on as they expand or start or revise their programs.
Sounds
Thank
amazing.
you.
Thank you, ladies.
Nice
So